The physician role begin with crucial task of diagnosing diabetes. They order for fasting blood sugar tests to measure blood sugar levels after overnight fast, oral glucose tolerance test, hemoglobin A1C test, to provide average blood sugar level over the past 3 months. The physician also ensure patient inclusion, engaging the children with appropriate age discussion about their condition to foster understanding and compliance, and involving the family in decision making too as well. The physician education responsibility include teaching the science of hypo and hyperglycemia and how to respond to them, demonstrating the use of medical devices for monitoring blood glucose and administering insulin, such as glucometers and insulin pen and pumps. Managing diabetes in children requires multidisciplinary approach. Physicians lead a team in ensuring corrective and unified patient care. Collaborating typically involve dietitians, diabetes educators, pediatric and psychologists or social workers to support children mental health and assist the family in coping with the diagnosis and ongoing management challenges.
The nurse. The nurse is the one who will carry orders from the physician. They'll also are the one who will be able to question and interpret these orders. They are one of the first line of defense when it comes to pre-diabetes prevention and screening. Diabetes is becoming more prevalent in adolescents. Nurses are able to recommend pre-diabetes screening to physician. If a child is showing pre-diabetes symptoms, the nurse should report immediately to the physician. Nurses should also stay up to date on pre-diabetes and type 2 diabetes in children's screening literature. Nurses are also the ones who are able to perform glucose tests. They ensure that they are correctly tested. They're also responsible for making sure that the tests are done on time, as well as recommending different ways of prevention, such as exercise and small diet changes. A potential barrier for nurses is communication. Some nurses may be afraid to speak up. To fix this, we need to change the culture about patient advocacy. Nurses should feel comfortable in what they are concerned about. Nurses should ensure that the child and parent understand what their concerns are and adjust their teachings accordingly.
Dietitians are an important part of the intercollaborative team when caring for kids with diabetes. Nutritional guidance needs to be tailored to the patient based on their current growth and developmental needs. This will be critical to the diabetes management. Education is key for our patients as well as their families. Teaching them how to manage their diabetes, making good choices when out to eat, insulin to carb ratios, and the effects that different foods have on our body. It's also important to how to manage low and high blood sugar. Adolescents tend to struggle with compliance. They feel themselves being different, feel like they're alone, and they're not able to do the things that other kids are able to do. So it's important for us to offer motivation and support. Family involvement is important. Kids with diabetes depend on adults to provide healthy options, but sometimes they don't know how. Either they can't have access to healthy foods, or they don't have access to the supplies or how to check their sugars. So it's important to make sure that they're linked up with places such as WIC or food banks.
What are the potential barriers our team faces when addressing diabetes in adolescents? One major obstacle is poor communication among team members. In hospital settings, individual rounds can lead to missed updates. Additionally, unclear responsibilities may leave patients' needs unmet. Fortunately, solutions exist. Daily huddles can ensure all team members remain aligned, while clearly assigned responsibilities and supportive teamwork alleviate burdens and enhance collaboration. In reviewing the case of Noah Lord, our team identified 2 barriers to effective teamwork: inadequate information sharing and a lack of coordination and follow-up. Team members failed to relay crucial details to one another. Individuals did not inform Noah's family about critical information, and the organization did not promote a culture of patient-centered care. Implementing strategies like team steps could have prevented this tragedy. Clear communication by SBAR could have alerted physicians to Noah's condition. Stronger team leadership might have empowered nurses to advocate for Noah's needs more effectively. A shared mental model would have ensured all team members maintain situational awareness and communication. Finally, implementation of a two-challenge rule would have ensured concerns were addressed appropriately. By fostering a culture of collaboration and communication, we can enhance patient safety and outcomes. We must learn from past failures and continually improve to ensure every patient receives the highest standard of care.